Hi, I'm Gordon Smith and welcome to the first element in the teacher pathway in this course on the Assessment Design Framework Modeling Approach to Education. In the first elements of the course, we reviewed how education consists of a system including the teacher, learner, content, and environment. In this branch of the course, we'll focus on how you as the teacher can use ADFM to create high-quality educational activities. In this element, we'll learn about the learning cycle. The objective is for you to be able to define and identify high-quality performance objectives and to list and describe the 5 components of the learning cycle, the 5 E's. Have you ever taken a course or been to a lecture where you found yourself wondering, why am I here, or what's the point of this activity? Most of us have experienced this feeling at some point, particularly in the first year of medical school. Consider how much better an educational activity seems when we understand the purpose and appreciate its relevance. The foundation of any successful teaching exercise is a well-crafted performance objective that sets expectations and promises value and relevance. Consider the following question. Why do we use the term performance objective rather than learning objective or goal? The reason is that the goal of our teaching is to change the behavior of the learner. Our aim is not just for them to learn, but to act on that learning, to perform. We want our neurology residents to not only learn how one should do a lumbar puncture, but to actually learn to perform the procedure themselves. A good performance objective has several features. First, it must be appropriate to the audience. The performance objective must be appropriate for the specific learner. For instance, it's not reasonable for a medical school neurosurgical rotation to have learn to perform a carotid endarterectomy as a PO. A better objective would be learn to identify patients appropriate for referral for CEA. Second, it must have a measurable outcome. Third, the performance objective must directly link or lead to a valid assessment. And fourth, it must convey to the learner what the teaching will accomplish. Let's assume we are preparing a lecture on secondary stroke prevention. Which of the following 4 potential performance objectives is the best? I'm sorry, that wasn't the best answer. The best objective among these is number 1. Let's talk about why. The verbs in each of these performance objectives are positive. What differentiates the verb recognize from learn, appreciate, and improve? Recognize is the most measurable of these. We can assess whether the learner recognizes a situation by asking simple questions. In contrast, it's difficult to determine if your student appreciates something. Good verbs for performance objectives can be divided into those that measure cognitive, affective, or psychomotor outcomes, each of which has a number of subcategories. There are also a number of verbs that should be avoided. Click on each category to explore both good and bad verbs for performance objectives. A full list will be available for download among this element's resources and in the course syllabus. Once you have determined your performance objective, the next step is to build your educational activity. In the learner pathway, we discuss how our brains organize information into discrete elements which together form a model or schema. The same is true in teaching. We organize our content into learning elements which combine to form the building blocks of our educational activity. We will learn more about how elements combine to form a course in the next element. Now we will define the structure of the individual learning element. Good teaching shares many features with good storytelling. Both a good storyteller and a good teacher capture your attention and engage you in the experience. Both involve you in the activity and adapt to your responses, and both follow a predetermined structure, even if that structure adapts to the specific circumstance. Many of you will recall from high school or college literature the classical structure of a theatrical drama. This structure was first described by Gustav Freytag in 1863 and is now often referred to as Freytag's pyramid. Most classical drama begins with an introduction which is followed by rising action leading to a dramatic climax. There follows falling action and a resolution, or in tragedies, a catastrophe. The denouement releases tension and provides closure. This structure is followed in many forms of literature, including short stories. In the same way drama may be defined by a Freytag's pyramid, learning elements have an intrinsic structure. This structure, which can be remembered as the 5 E's, consists of engagement, exploration, explanation, elaboration, and evaluation. The first E is engagement. Before teaching can begin, we must first capture the attention of the learner. There are many different ways of achieving this goal. Many teachers begin with an anecdote that often has some emotional valence, either positive, such as humor, or negative, such as fear or sadness. One familiar example of engagement is of a comedian warming up a crowd. In addition to an emotional appeal, other options include novel stimuli, personal relevance, hands-on experience, and identifying patterns. The purpose is to hook your learner, to fasten their cognitive attention processes on what you're doing. Consider how you can generate your learner's interest so they will be motivated to follow you through the learning cycle. We began the course hearing about Professor Marty Samuels from one of his former students, Dr. Stefan Pulst. Let's hear how Dr. Pulst describes Marty's ability to engage his learner.
And in addition, I have to say, Marty is very funny, and that makes it very memorable. And when residents meet, we have all heard many of Marty's lectures, and like with great stand-up comedians, we will remember the one-liners that are indelibly inked in our memory. Only in retrospect you realize that your attention has been grabbed, and it's a fine mix of science, of some anecdotes, of sometimes seeing the humor that even happens in tragic situations with patients.
For those of us who have heard Dr. Samuels teach, this story is familiar. He engages his learner by entertaining them, often with humor. One, of course, must be cautious that the engagement is in alignment with the content. It's not sufficient to just tell a joke or charming story. The content of the engagement must draw the learner into the content of the course. They want to know what's in it for them. The second E is for exploration. We learn in the learner pathway of this course the need to assess the learner prior to teaching. Knowledge has a structure. Simple knowledge is flat or two-dimensional, such as a list. Expert knowledge is highly folded like origami. Before the teacher can begin, she or he must assess the learner's baseline knowledge, how folded it is, then unfold theirs to match. Teaching then involves refolding the learner's knowledge into a more dimensional structure. Here is another video of Dr. Pulst describing Dr. Samuels' teaching.
To draw the participants in and having everybody participate. And Marty is a master in that also. Very often he teaches to medical residents that very often don't really have the necessary knowledge to start. And Marty has a wonderful way of pulling whatever they know out of them and then very calmly directing them in the right direction.
This video emphasizes a very important point about the 5 E's. Expert teachers often use one E to transition to another. They are essentially serving overlapping duty. In this example, Dr. Samuels engages his learner and in doing so explores their starting knowledge so he can move them in the right direction by refolding their knowledge into a more expert or complex structure. The third E is explanation. During the explanation phase of the learning cycle, the teacher explains the topic at the level initiated by the learner. This stage is what most of us think of as teaching. The basic content of the learning event is conveyed to the learner. Note, however, that for this to succeed, the learner must be engaged and the teacher must know the level at which the learner is starting. Otherwise, the learner won't be paying attention, or if they are, the content may be too simple and thus boring, or too complex and therefore difficult to understand. In the learner pathway, we discuss cognitive load theory. The cognitive load of the content must be appropriate to the learner. In explanation, we're striving for new understanding, for the aha moment when the knowledge structure and its relationships to other concepts come into focus for the learner. The fourth E is elaboration. During the elaboration, the teacher endeavors to extend the learner's understanding towards the performance objective. Teachers who are just beginning to use ADFM often find the line between explanation and elaboration confusing. This is because they essentially describe the process of refolding the learner's knowledge structure. Exploration involves recognition of the simplicity or complexity of a learner's knowledge structure Explanation begins the process of folding the knowledge into a more complex form, and elaboration is the evolution of the process that achieves the performance objective. Elaboration can take place within the learning cycle, or you can leave hooks for additional resources your learners can explore later on their own to take their understanding deeper into the subject matter. The final E is evaluation, the process by which we test the effectiveness of the teaching moment or learning episode. Assessment is at the core of the ADFM methodology. The learning cycle begins with an exploration of the learner's knowledge and closes with an assessment of whether our performance objective was achieved. This E therefore brings us full circle because in order for the learning cycle to fully succeed, the evaluation must accurately measure whether the performance objective has been achieved. Has the learner changed? The learning cycle can be applied to any teaching exercise no matter how brief. Indeed, an excellent way of practicing this aspect of ADFM is by performing the 5-minute teachable moment exercise. In this exercise, the teacher has 5 minutes to present an entire learning cycle from engagement to evaluation. The following video is an example of a 5-minute teachable moment from an ADFM workshop conducted at AAN headquarters. As you watch it, think about what the performance objective is, what the 5 E's are, and whether the objective was achieved, and if yes, how the teachers knew this was the case.
When you were in your neurology residency, did you learn the dance? And I don't mean the merengue or the foxtrot or the waltz, but did you learn how to do the visual field dance? Did you ever do the visual field dance? Did you see your attendings do the visual field dance? You know, when I walk up to the bedside and they start doing this, okay? Well, we are here to tell you that there's a much better way to do the visual field test at the bedside. So first we want to talk about why we even do the test and what we're looking for. So let's start at the beginning of the visual system and work our way to the back and talk about visual field defects that you see in certain places in the anatomy. So starting with the optic nerve. What kind of visual field defects do you see with the optic nerve? Anyone? Monocular what? What do you call it?
What?
What's the name of the visual field defect? Central scotoma. Okay, what other kind of visual field defects can you see with optic nerve problems? Altitudinal field defect. Okay, let's move back to the chiasm. Now in the optic chiasm, what kind of visual field defect do you get? Bicenteral hemianopia, perfect. And then behind the chiasm? Homonymous hemianopia. Perfect. So if we see somebody that comes in with an optic neuropathy and we're looking for a central scotoma, are we going to be able to pick it up by doing the dance? The dance doesn't work for that, right? So what we'd like to teach you is the no-fail way to do a visual field test at the bedside. And this comes also in 3 steps. The first is the central field. The second is either side of the midline, and the third part is the peripheral field. So, central field, first of all, we're always going to test one eye at a time, and you're going to face your patient, in this case John, and we're going to ask John to cover one eye. And for the central field, I'm going to use my face as the target, and I'm going to close my right eye because he has covered his left eye. Well, actually, I'm not going to do that yet. If you look right at my nose, can you see my whole face? And do you see all parts equally well?
Yes.
And are any parts missing?
No.
Okay, so we have right away screened the entire central 20 degrees or 25 degrees of the visual field. And so we know he doesn't have a central scotoma, and we know he doesn't have an altitudinal field defect. Part 2 is splitting either side of the midline. So I'm going to close my right eye so that when I look him in the eye, my visual field is the mirror image of his visual field, and midline for me is midline for him. So look me right in the eye, and I'm going to show him fingers on either side of the midline. Tell me how many fingers you see.
3.
Great. Now?
4.
Now?
2.
Great. So in that simple step that took about 3 seconds, I know that he probably doesn't have a homonymous field defect. And then lastly, we're going to outline the border of the visual field. So same thing, I'm going to use mine as the control, as a mirror image of his. Look me right in the eye and tell me when you see my hand.
No.
No?
No. No. No.
Great, and what you should outline is a nice ellipse that is much bigger temporally than it is nasally. Now this actually only takes about 30 seconds to do, and so let's switch eyes and we'll run through the entire thing. If you look at my nose, you see my whole face?
Yes, I do.
All parts equally well?
Yes.
Any parts missing?
No.
Okay, look me in the eye. Tell me how many fingers you see. Now?
2,
Now?
3.
And tell me when you see my hand.
No. 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 No.
Okay? And that's it.
Now, most of you probably think we already learned this in medical school and in neurology residency, but I bet that not everyone in this room does this. And I would submit to you that, sure, there are better ways of assessing visual fields on a formal basis, like Goldman or Humphreys. But in terms of the true goal, which is to not miss any major visual field deficits, this is a very quick and easy way of doing it and should be standardized part of everyone's neurologic assessment. Simply doing the dance takes time and really doesn't accomplish what you're looking for. So we demonstrated twice. We'd like for you to turn and with your partners run through each exercise, one person doing each eye and then flipping. Yeah, hold on, straight up. All right. So we hope that you learned a very quick 30-second technique, and I would encourage you to incorporate it into your regular neurologic exams.
Any questions?
This video clip provides a good example of a full learning cycle. Once you've had a moment to think about what the PO and 5 E's were, click on each to see what the teachers intended. The dance analogy serves as a humorous engagement that draws in the learner. The humor is in alignment with the objective and emphasizing the limitations of a commonly used method for evaluating visual fields. The teacher assesses the student's baseline knowledge of visual field abnormalities. If the students did not understand basic field abnormalities, the teachers would have needed to explain these concepts. The explanation is the description of the 3 different steps in the visual field examination: the central field, either side of midline, and the peripheral field. The elaboration anchors this technique to the range of methods used to formally assess visual fields, including perimetry. The teachers evaluated students' comprehension and performance by watching pairs perform the visual field examination. The ultimate, authentic evaluation of whether the students achieved the performance objective would require demonstration of competency in a clinical environment, that they never missed a major visual field abnormality. The performance objective was for the learners to be able to perform this simple no-fail method for screening the visual field and not miss any major visual field deficits in clinical practice. In this element, we describe the learning cycle. Each learning cycle is founded in a performance objective and consists of an engagement to capture the learner's interest, an exploration of the learner's baseline knowledge, explanation of the content starting at the learner's identified level, elaboration to dig deeper and approach the performance objective, and evaluation to determine if the objective was achieved. In the next element, we'll learn how to build educational activities using the principles you've already learned and to assess their success.